Your health, your life. Expert insight that matters. This is Health Matters.
Hi, I'm Nicole with Nikki Lamage Wellness, and I'm joined today with Dr. Derksen from Derksen Dentistry. And I gotta tell you, this episode I'm really excited about because I think it affects everybody a little bit. We're talking about Smile Makeover. This is something that you do in your office, but it's not like one size fits all. There's many different components.
Yep, definitely.
So can you tell us what a Smile Makeover is?
Yeah, so Smile Makeover is a unique treatment plan for an individual that entails multiple different components, right? So anything from tooth movement to tooth reshaping, changing a color to get to the aesthetics that that patient desires.
So truly a makeover. They're gonna, if their goal is to do something different with their smile. So what does it look like? I think there's different steps. Can you tell me the different things that you might do?
Yeah, for sure. So the first thing when somebody comes in, we'll sit down and talk about what their ultimate goals are. So sometimes it's just as simple as changing the color of their teeth. Sometimes it's changing the position. Sometimes it's changing the shape and the size. And so from the most basic components, we like to break it down and say, all right, if you're just worried about the shades, sometimes we can just do a whitening process. And that's pretty straightforward. The next level of that is we can do some reshaping with some composite bonding. And then there are more complex components involving orthodontia or tooth movement, and then porcelain, crowns or veneers.
You know, I hear a lot about veneers. You know, I'm sure everybody goes on TikTok and you see people and they're going to Turkey and they're going to all these places. And I don't know a lot about veneers to even know if that's safe. So maybe you can explain what veneers are.
Yep. So veneers, it's almost like a spectrum in terms of a restorative option. And veneers can be super conservative, right? So just as little work in terms of drilling or even touching the tooth. Basically, we're adding material to them. So we can do minimal or no prep veneers. And then there's other situations where the teeth are really malaligned and we don't want to go through the orthodontic component. So in terms of tooth movement, time-wise. So then we have to do a lot of drilling on a tooth to be able to create the space for the porcelain to be added on. In terms of kind of, we'll call them different levels, composite veneers or veneers that are made out of filling material. Those are probably the most conservative and most cost-effective options. Then the next level in terms of, we'll call it aggressiveness or work that ends up being done on the tooth structure, then it's going to be a minimal prep type veneer for the porcelain aspect. And then you can do the full kind of drilling a tooth down, which in many cases, that's not the best option. But some cases it's necessary. But again, you drill the tooth down and you layer porcelain on top of it. And kind of at that point in time, we can make things look as nice or as white as they want.
So let's break that one down a little bit more. When you're talking about drilling it down, and I've seen these photos where it looks like people have shark teeth because they've been shaved down to almost like a point. Is that what we're talking about?
Yeah, that's a bit extreme. That's not what we typically do. Yeah, no doubt. The goal with a veneer is to remain in the enamel. The enamel is going to be typically the outer millimeter to millimeter and a half of the tooth structure. And that's where if we have plenty of enamel on a tooth, we can actually bond that veneer so they can last a long time. As soon as you get to those, we'll call them shark teeth, at that point, it's not really bonding, we're cementing those on. And so they typically don't last as long and they're not as durable. I should say that the tooth is not as durable. The restorations are quite durable, but the teeth are not as durable. And so it's a bit more of a risk.
Well, because it has to attach to something.
Yep.
And so taking care of those, what does that look like for the person that goes that route?
To take care of those, the most important thing is really worrying about where the margins are. So the margins are the transition from the tooth structure to the porcelain. So as long as those are in a position where you can keep them clean, it's pretty easy to do that. But the cool thing about the porcelain veneers and crowns, they don't stain. So that's a big positive for a lot of people. But again, the problem is that you have to keep that margin, that transition really clean.
Well, that makes sense because it's got to hold on to something. But then you said there are veneers that are not quite as aggressive. And are they just as durable?
They are, yeah. And in many cases, they're actually even more durable. So the reason for that is that, so we have an opportunity to do let's say somebody has really small, narrow teeth and they have spaces in between them. We can do a minimal or no prep veneer where we really don't have to do any grinding or just a little bit of reshaping on the tooth structure. And then we can design the porcelain to go over that. And porcelain that's really, really thin is fragile on its own. But as soon as you use a proper bonding technique, it becomes as strong or stronger than the original enamel.
So that sounds like a really nice option. And people can expect those to last how long?
20 to 30 years is a pretty
That's a
reasonable
long time.
expectation in terms of kind of the minimal to no prep veneers, as long as they do a good job keeping them clean. If they don't do a good job keeping them clean, it's typically not the veneer or the crowns that fail. It's typically somebody getting a cavity or leakage underneath that by not maintaining like they should.
So do they come in and get their teeth cleaned just like they would if they didn't have veneers?
It's just as important or even more important to keep up on a regular basis, because in let's say a natural tooth structure that doesn't have porcelain on it, we can, if somebody gets a cavity, we can go in there and clean it up, remove the decay and bond. We can't really bond filling material to porcelain. And so sometimes we would have to replace that veneer or composite veneer or porcelain veneer at that time.
So, okay, so we've got the really aggressive where we're cementing, you said, the tooth on. Then we have the veneers that are the porcelain overlay. What would be the next step down from that, or the next option?
Yep, and so it's really adding more things to the whole repertoire, right? So what I mean by that is, again, we'll go back to the whitening. You want to get your teeth as white as they want to be. We have the composite, which we can just bond to the tooth. We have obviously the no prep veneers or minimal prep veneers, and then the crowns. And then the next kind of level is going to be combining that with some orthodontics, right? So actually tooth movement. So typically we do orthodontics. We're doing that to recalibrate the bite, get it to the point where they can function without, well, some people have headaches, let's say, along with the aesthetic concerns. And so if we can recalibrate the bite along with getting a positive aesthetic outcome, that's going to be kind of we'll call the full package. So whitening, some kind of composite or porcelain addition, and on top of orthodontics.
Would you ever do orthodontics first, or how do you normally approach that?
Yep, so we would almost always, very rare cases, we would do orthodontics at the end, but typically we would do orthodontics at the beginning and get the teeth in the position that we want to. And the biggest advantage of doing that is to make it so we have to do less drilling on the tooth structure. So the tooth, kind of one of the things that I really believe in is a strong tooth equals a strong restoration. And if you have too much work on a tooth, it doesn't typically last as long.
Well, that makes sense. What are their options now? Because there's a lot of new things that have came out in the world of orthodontics. It's not the full mouth of metal like I had with the rubber bands.
No. So the majority of patients will either fall into a traditional orthodontic realm, which is brackets and arch wires, and then the other group is going to go into the clear aligners. And there's a lot of different brands, a lot of different options out there. One of the more common brands is called Invisalign, which most people have probably heard of, but that's a brand name, and then they have lots of other versions of them. And they all are, again, essentially clear aligners that help move the teeth sequentially. So basically the way that works is we start with where the patient is, and then we create a treatment plan of where we want those teeth to end up. And then we use an algorithm to figure out how many different trays we'll need to be able to move those teeth in a safe and effective manner.
And if their dog chews it up?
Yeah, it happens. And typically in that case, which is nice with digital dentistry, is if somebody loses their aligner, they throw it away, or the dog chews it up, you go back one step, call us, we'll get you a new one, and then you just keep moving forward.
Okay. Because I always think, at least when the brackets were in, I couldn't screw those up. But I'm pretty sure as a kid I would have tossed my...
We go through a lot of extra aligners based on the fact that, again, typically a lost one, but definitely a dog is a pretty common reason not to have one too.
Yeah, I can see that. And then is it faster now, to get the teeth moved, or is it the same long process that it's always been? Because you're still moving teeth around.
Yes. So one of the neat things about the clear aligners is that we can move them in a more precise, custom tailored to that patient's situation. So if we only have a couple teeth to move, it's pretty quick, right? We can get it in a matter of, we'll call it 2-3 months. If we're doing the whole mouth, changing the bite, it still could be 16, 18 months, sometimes less, but on average, pretty similar timeline.
That's not so bad.
No.
And I'm going to assume they still have to wear retainers or something afterwards.
Yes. So any kind of tooth movement, as well as somebody that goes through most of the smile makeovers, there's some kind of retention that we want to entail, because A, if somebody clenches and grinds their teeth, we want to make sure that they don't cause damage to the restorations. B, if we do some kind of orthodontic work, teeth are dynamic, right? They're always going to want to move. And our tongue, our lips, they're pretty strong muscles, and they can move things in a direction that we don't necessarily want them to go. So if you are really happy with the end result and you want to keep it that way, the best thing to do is make sure you either wear your retainer or a bite splint.
So then, and I know this because I was just at your office getting mine. I'm like, what about, now we touched a little bit, is bonding different than the veneers?
Yeah, so bonding is a type of veneer, basically. So you can, well, let me step back one. So we bond veneers to tooth structure.
Okay.
And a lot of people refer to bonding as composite veneers or composite bonding. Okay. So that is a process that we can actually do right in the office the same day. So if somebody comes into our office and says, hey, I want to do some veneers, and I would like it done for an event tonight, really our only option is to do composite veneers. A full case of veneers takes quite a bit more time to be able to get done for a quick event.
I had no clue you could do it that fast.
Yep, definitely.
Now, we touched a little bit on how long the porcelain veneers last. Do these last the same length of time?
No, yes and no. So they will collect some stain. They will need a little bit more maintenance, but they're also more cost effective.
Okay. And do they have the same risks with, if you don't take care of them, or are they a little bit easier?
They're a bit more forgiving. Yep, because we're not typically drilling on the tooth, and we can take a little bit of material away and then add it on at a later time. So they're adjustable throughout the process.
Okay. And then whitening. Tell me the options for whitening, because I feel like there's a lot more options than
there's a ton of them. So in terms of whitening, it's a relatively simple process. There's obviously home whitening and in-office whitening options. And in terms of the home whitening options, there's things like Crest White Strips. Alternate has a really nice product out there, and those work quite well. They're a little bit more complicated to use, and they're less user-friendly. And they take a lot more time to get your teeth lighter. And then the in-office options go to custom trays, right? That's going to be a really cost-effective way of doing it, and it's pretty predictable based on the fact that we can use stronger materials so they can whiten in a shorter period of time and get superior results to the over-the-counter products. And then the final option is the in-office Zoom whitening that we do in our office. There's other different brand names of it, but it's about a 2-hour process. You come in, take impressions. We go through a process of creating a liquid dam, and the dam will protect the gum tissue because the material's pretty strong. It can cause some damage to the gum tissue. And then we make sure it happens to the level of expectations for that patient. So somebody will come in, they'll look at it and say, this is the shade of my teeth, what can I expect? And we can give them a pretty reasonable expectation of what they're going to expect. And we have 4 cycles that it goes through, so each cycle is 15 minutes. So again, the whole process is about 2 hours.
Okay. But that would be the fastest, because they're leaving that day.
They're leaving that day. Yep.
Are they going to have sensitivity?
Yep. So that was a very common problem early on in the process, but we actually utilize a prescription straight toothpaste. The ideal thing is to have them use it for 2 weeks ahead of time. So if somebody comes in and says, I want it done today, and they didn't have the prescription, they should expect some sensitivity.
And how long will that last for?
A couple days.
Oh, so that's not terrible.
No.
I was like, oh God, are they ever going to eat ice cream again?
Yeah, yes, we'll make sure they're able to do that. And the other cool thing is that we'll typically do a fluoride treatment afterwards, which will help decrease that sensitivity pretty significantly. And then we can send them home with trays and additional desensitizing treatments, so that way that they don't have any kind of duration of that.
Okay. So quickly going through them, like, who is a good candidate for each one of these things? Like if I was going to say veneers, who's the ideal candidate?
Yep. So if somebody wants, if somebody comes in and they have relatively small teeth and the shade or the color is nice, then the minimal prep, no prep veneers is a great option. If somebody comes in and has a couple teeth that are, again, either maybe a little bit small or malaligned where one sticks out a little further than the other, that person could be a really good candidate for a combination of minimal prep to no prep veneers, and or they could probably use some composite, so the bonding composite on there. And then somebody that comes in with a really crowded, discolored set of teeth, then we would do kind of the more traditional veneers where we do a bit more aggressive adjustments to the enamel. And all of them end up being really nice, but we just don't have as many options with the minimal prep or no prep and the composite veneers, just because they can't change the color very much, at least, and we can't change the shape as much as we can with the normal preparations.
And for somebody that wanted to start and get on this process of their Hollywood smile,
Yep.
what do they need to do?
Yep. So first thing to do is just give us a call, and we'll get you in for consultation and talk about what the different options are. It's always nice to have an idea of what you're looking for. So sometimes people come in and say, I want whiter teeth, or I want bigger teeth, or I want everything to be in the proper alignment. And as long as we have a place to start, we usually can create a pretty good plan together.
Okay. So they can call Derksen Dentistry. I know they can go online,
Yep.
but thank you for your time today.
Oh, my pleasure. Thank you.
All right, I'm with Dr. Soufian today from Mid-Michigan Auntie. Thank you. I have a question. A lot of people complain about allergies. How does somebody get tested?
Typically, patients that show up into our clinics are complaining of allergies. They've tried the over-the-counter medications, and what happens is we schedule an appointment. They have to refrain from taking their allergy medications, typically for about a week, because that can affect the test results and give us some false negatives. And when they come in, they do a series of kind of skin pricks, essentially testing the different pollens and allergens. And once they get those results, they'll go over it with a clinician, come up with a treatment plan.
So let's say they get the results back and it comes back they are allergic to pollen, dust, whatever it is. What would the treatment for that look like?
Depending on the severity, sometimes it will be medication, but for those patients that have severe allergies and a multitude of allergens, what we do is we typically recommend either injections, or in some cases we can do what's called sublingual therapy, which is instead of shots, some people have a fear of shots or just don't have time to stop into the office, we can do a daily drop under the tongue. So the patients will take that serum with them and they do it on a daily basis, and that will treat their allergies.
Is that new? Because I've never heard of the drops. I've heard of the shots, but...
Yeah, sublingual therapy is not new. The efficacy is similar to injections. It's just a lot of times it's not covered by insurance. So most people use the option that their insurance covers, so it's less utilized.
Okay, well, you heard it. Lots of different options for your allergies. Thank you.
Dr. Ross, board-certified gastroenterologist with a health tip. Drink plenty of water for a healthy digestive system, which breaks down food so your body can absorb vital nutrients. Drink at least 8 glasses a day and protect your health.
Hi, this is Nicole Taylor from Nikki LaManche Wellness in Okemos, and I am so excited. Today I have with me Kyla Evans. She has been in the beauty industry for a long time. We have a lot of knowledge. One of the devices we have in our clinic is the Quantum RF, and it's a newer technology, but I don't think people are super familiar with what Quantum is. Would you mind explaining?
Yeah. So this is one of my absolute favorite treatments. What it uses is it uses radio frequency, but it uses it subdermally. So we're under the skin, really right at that fat and skin layer.
And by doing that, what does it do to that fat?
Yeah. So the radio frequency, it's heat energy, and so it melts the fat. And we're in that fat layer, so we're able to really get a great reduction in fat in whatever area you're treating, but at the same time, it's tightening skin.
Which is exciting, right? Because liposuction doesn't tighten skin, but it removes fat.
Right.
And this gives you a little bit of both. Does it require anesthesia?
It doesn't. It doesn't. So it's a super easy procedure. It takes about 1 to 2 hours. There's no anesthesia. You're fully numb and comfortable for the full procedure.
Yeah, and downtime from these procedures?
The downtime is minimal. Because of the method of action, we're really not seeing a whole lot of discomfort or swelling post-procedure. You'll go home, you'll wear a compression garment for a couple days, and you'll go about your normal life. It's really unlike any other procedure that's out there.
Well, and I find it exciting, right? Everybody has a stubborn place, right? Whether it's, C-sections below that scar, or, those love handles or bra fat, you name it. And you can really get in there and be effective.
Yeah.
The treatment works. It's wonderful. No anesthetics, no downtime, and it's not painful.
It's not.
So, well, thank you for joining us today.
Of course.
When your ears, nose, or throat need attention, you deserve care that listens. At Mid-Michigan ENT, our board-certified specialists have been delivering compassionate, personalized solutions since 1997. From same-day appointments to advanced hearing assessments, allergy treatments, and facial plastics, we're here for you. Hear better. Live fully. Start your journey at midmitchent.com.
So I'm with Dr. Lee Allen from Digestive Health Institute. Welcome, and I want your take on colonoscopies. When do we schedule these, and should we?
Awesome question. I always tell my patients that colonoscopies are awesome because they are literally the only procedure without surgery in which we're able to prevent colon cancer. There are not many cancers in medicine that we can prevent, but colorectal cancer is absolutely one of them. And we do that by being able to find those things called polyps, which are typically pre-cancerous tissues, so before it's begun the process of becoming cancer, and we remove them, taking away that tissue's opportunity to become cancer at a later date.
So we're just stopping it in its tracks.
Yes.
And how old should we be?
You should be, if you do not have a family history,
Okay.
so meaning no family history in your first degree relatives, your parents, your siblings, or your children. If none of those people have history of colon or colorectal cancer or large colon polyps, then you can begin at age 45.
Okay.
Yes.
And that's different than what it used to be.
It is different than what it used to be.
Okay. So, because I think I'm behind over here. I'm guilty.
Scheduled today.
Is it painful?
No. not
Okay,
at
so
all.
nothing to fear. I should go ahead and make my appointment.
You'll get a good sleep. Oftentimes the prep is more important for us to detail and make sure you get through that. But the sleep we reward you with.
Well, and preventing and stopping cancer in its tracks,
Absolutely.
I mean, that's worth it.
And yes, absolutely.
All right, so schedule your appointments today.
Schedule today.
Oh, thank you so much.
Okay.
Life changes everything. Hormones shift, metabolism slows, muscle declines, and skin loses structure. At Nikki Lamage Wellness, we don't treat these as isolated problems, we treat the system. Through precision hormone optimization, metabolic weight loss strategies, IV nutrient therapy, red light sauna, and with the addition of InMode Quantum RF, we now stimulate deep collagen remodeling and targeted fat reduction without surgery. Aging well isn't about chasing youth, it's about restoring power. I'm with Dr. Derksen from Derksen Dentistry. And Doctor, we hear a lot about TMD. What does that mean?
Yep, so TMD is defined as the temporal mandibular disorder. So it's basically, so your temporal mandibular joint is right here, right in front of your ear. It's what allows your jaw to move and manipulate. And most people say they have issues with that joint. And some of it's actually pathologic, meaning you have problems with the disc, you can have dislocations. The other parts are kind of self-induced issues, clenching, grinding, stress, those types of things can cause significant problems with that joint.
And if you're clenching and grinding all the time, what are the long-term side effects of that?
Yeah, so you can end up with popping and clicking when you talk, when you eat. You can end up with chronic pain. And then the other big one for a lot of patients that ignore the signs and symptoms, they can end up with really limited openings to the point where they can only open their mouth about that far.
Oh, that's kind of awful. And so treatment for this?
Yeah, so the first thing to do is get an evaluation of the joint itself to make sure that there's nothing, we'll call it quote unquote wrong with it, nothing that's that would require any big problems. And then the next level is to look at potentially a bite splint and then sometimes physical therapy.
Physical therapy. Okay. Yep. Well, I know that I see you, and you gave me this bite splint, and I'm happily wearing it. We're compliant.
Good.
So
thank you.
I appreciate you, and people can get it taken care of.
Yes, definitely.
Thanks.
When it comes to your health, choosing the right care team matters. At the Urology Institute, you'll find experienced specialists who focus on personalized treatment plans tailored to your needs. We offer advanced technology, a full range of services in one place, and a team that works together to support you every step of the way. From diagnosis through treatment and beyond, our goal is simple: deliver high-quality care with compassion, convenience, and confidence you can trust.
I'm with Dr. Cardenas from the Cancer and Hematology Center, and you specialize in a lot of things, but my niece had leukemia, and during her course of treatment, she never received any radiation, and that was appropriate, correct?
Yes, it's not commonly used for leukemia. So radiation is a targeted therapy. So, leukemia is a cancer of the blood, so it's everywhere in the body. So it wouldn't really be amenable to, treating the entire body with radiation. There's some rare exceptions to that. Sometimes radiation has some role in prepping the immune system for like a transplant in leukemias. But for the most part, radiation is used for solid tumors that are, localized and targetable.
So it's really more of a specific treatment for the most part. Not every time, but for the most part.
Yes, it's a focused treatment at a specific area.
So an area that would be really good for radiation, you had mentioned before, was like prostate.
Yeah, so prostate cancer, the prostate is it's in the pelvis, targetable area, and so it's very amenable to treat the entire prostate with radiation, or areas at risk in the pelvis with radiation. Another example might be breast cancer after a surgery. It's easy to radiate the breast or the chest wall. The patient's had a mastectomy, but it's a localized treatment. It's a targeted treatment. And so if you have a cancer that's, exists everywhere in the body, such as a leukemia, then it's, it has kind of a limited role.
Well,
very specific situations.
Well, thank you for explaining that to us. I think that really helps, and we appreciate you.
Thank you.
UTIs are more common than you think. UTI signs include burning when you urinate, frequent or urgent need to go, cloudy or bloody urine, and lower pelvic pain. Drink plenty of water. See your doctor promptly for a urine test.
Stay informed at healthmattersmi.com. Thanks for watching.